Have you ever started your morning the same way you have for years, believing it was perfectly healthy? Maybe you wake up, pour a cup of coffee, skip breakfast, sit down to read the news, and don't think much about it. It feels comfortable. It feels normal. But what if one or two of those simple habits were quietly putting extra strain on your heart? After the age of 60, your heart changes naturally. It may not pump quite as efficiently as it once did. Your blood vessels become less flexible, and recovering from unhealthy habits often takes longer. The surprising part is that many of the choices we make within the first hour after waking up can influence blood pressure, circulation, blood sugar, and even the amount of stress placed on the heart throughout the day. The good news is that small adjustments can often make a meaningful difference. You don't need expensive supplements or complicated routines. Sometimes changing just one morning habit can help support better heart health over time. Today we'll look at several common morning habits that many older adults don't realize may be affecting their heart. Some are surprisingly common, and the final one is something millions of people do every single morning without giving it a second thought. Let's begin. As we grow older, our bodies become a little less forgiving. During sleep, we go several hours without drinking water, eating food, or moving around. When we wake up, our body is already adjusting to a new day. Blood pressure naturally begins to rise in the morning. Doctors sometimes call this the morning blood pressure surge. It's a normal part of the body's internal clock. But in some people, especially those with high blood pressure or heart disease, it can become more significant. That's one reason heart attacks and strokes occur slightly more often during the morning hours than at other times of the day. While we can't eliminate every risk, we can build morning habits that support our heart instead of working against it. The first habit is one many people never think about: starting your day without drinking water. Imagine waking up after 7 or 8 hours of sleep. During that time, your body has continued to lose water through breathing and sweating. Even if you don't feel thirsty, you may already be mildly dehydrated. Dehydration simply means your body doesn't have as much fluid as it needs to function at its best. When that happens, your heart has to work a little harder to pump blood throughout your body. Your blood may become slightly more concentrated, and some people notice dizziness, fatigue, or headaches. For healthy older adults, drinking a glass of water after waking can be a simple way to begin replacing those overnight fluid losses. Of course, not everyone should drink large amounts of water. People with certain kidney conditions or heart failure may have fluid restrictions recommended by their healthcare provider. That's why it's always important to follow your doctor's advice if you've been given specific instructions. A simple glass of water before reaching for coffee can be a small but helpful habit for many people. Speaking of coffee, that brings us to another morning routine that deserves a closer look. The second habit is drinking coffee before eating anything. Now, let's be clear, coffee itself isn't the enemy. In fact, research suggests that moderate coffee consumption may fit into a healthy lifestyle for many people. The issue isn't necessarily the coffee, it's when and how you drink it. For some people, especially those who are sensitive to caffeine, drinking strong coffee on an empty stomach may temporarily increase heart rate, raise blood pressure, or make them feel jittery. Others may experience acid reflux or stomach discomfort. Imagine someone waking up, pouring 2 large cups of strong coffee, and skipping breakfast until late morning. They may feel energetic at first, but a few hours later, they experience a crash, leaving them tired and hungry. A more balanced approach is to pair coffee with a nutritious breakfast whenever possible. If you already have high blood pressure, irregular heart rhythms, or notice that caffeine causes palpitations, a feeling that your heart is racing or fluttering, it may be worth discussing your coffee habits with your healthcare provider. Everyone responds differently. Paying attention to how your own body reacts is often more helpful than following one-size-fits-all advice. But the next habit surprises many people because it has nothing to do with food or drinks. It's about what you do or don't do after getting out of bed. The third habit is sitting for too long first thing in the morning. Picture this. You wake up, you make your coffee, you sit in your favorite chair, then you spend the next hour watching television or scrolling through your phone. Before you know it, you've barely moved since opening your eyes. After several hours of sleep, your muscles, joints, and circulation all benefit from gentle movement. You don't need an intense workout. In fact, for many older adults, simple movement is exactly what's needed. Walking around the house, stretching gently, opening the curtains, taking a short walk outside. These small actions encourage healthy circulation and help your body transition into the day. Physical activity also supports healthy blood pressure, blood sugar control, and overall cardiovascular health. One large misconception is that exercise only counts if you're sweating heavily. That's simply not true. Even light activity performed consistently can offer meaningful health benefits. If you have arthritis or mobility challenges, choose movements that feel safe and comfortable for you. Chair exercises, gentle stretching, or walking at your own pace can all be excellent options. Before beginning a new exercise routine, especially if you have heart disease or other medical conditions, speak with your healthcare provider about what's appropriate for you. Now here's something many people don't realize. Even if you eat a healthy breakfast and stay active, another common morning mistake can quietly affect your heart for years. The fourth habit is skipping breakfast altogether. Breakfast has been debated for years, and researchers continue to study the best eating patterns for different people. Some individuals do well with intermittent fasting, while others feel better eating in the morning. The important point is not that everyone must eat breakfast, it's that consistently skipping meals can affect people differently, especially older adults with diabetes, those taking certain medications, or individuals who become lightheaded when they don't eat. Imagine an older adult who takes medication for diabetes but skips breakfast every morning. Their blood sugar may fall too low, leading to shakiness, weakness, confusion, or dizziness. On the other hand, someone else may simply become so hungry by lunchtime that they overeat highly processed foods. For many people, a balanced breakfast containing protein, fiber, and healthy fats helps provide steady energy throughout the morning. Examples include oatmeal with nuts, Greek yogurt with berries, whole grain toast with eggs, or fruit paired with unsweetened yogurt. These foods digest more slowly than sugary pastries or sweetened cereals, helping many people avoid large swings in blood sugar. And that leads perfectly into another habit that affects not only your heart, but also your energy levels throughout the day. Many breakfast foods that seem healthy at first glance may actually contain surprising amounts of added sugar, and the one we'll discuss next is probably sitting in millions of kitchens right now. Many breakfast foods are marketed as healthy, but it's worth taking a closer look at the nutrition label. The fifth habit is eating a breakfast that's high in added sugar and low in nutrients. A bowl of colorful cereal, a flavored muffin, a sweet pastry, or a sugary breakfast drink may seem like a quick and convenient way to start the day. But many of these foods are digested very quickly. That can cause a rapid rise in blood sugar, followed by a drop a few hours later. Over time, eating a diet high in added sugars may contribute to weight gain, insulin resistance, and other conditions that increase the risk of heart disease. Instead, try building your breakfast around foods that keep you feeling satisfied for longer. Think of foods like oatmeal topped with walnuts and fresh berries, scrambled eggs with vegetables, plain Greek yogurt with fruit, or whole grain toast with avocado. These meals provide a better balance of protein, fiber, and healthy fats, which help support steady energy throughout the morning. You don't have to make the perfect breakfast every day. Even replacing one sugary breakfast with a more balanced option several times a week is a positive step. Now, let's move to another morning habit that many people don't even realize they're doing. The sixth habit is checking stressful news or your phone the moment you wake up. Imagine opening your eyes and immediately reading upsetting headlines, worrying emails, or stressful social media posts. Within minutes, your mind is racing, your shoulders tighten, your breathing becomes shallow. You may not notice it happening, but your body does. Stress activates hormones like adrenaline and cortisol. These hormones are helpful during emergencies because they prepare your body to respond quickly. But beginning every morning in a state of stress may not be the healthiest way to start your day. For some people, it can temporarily raise heart rate and blood pressure. That doesn't mean you should never watch the news or use your phone. Instead, consider giving yourself a few peaceful minutes first. Open the curtains. Take several slow, comfortable breaths. Drink some water. Stretch gently. Step outside for fresh air if the weather allows. Starting your morning with calm rather than constant stimulation may help set a more relaxed tone for the rest of the day. Another simple practice is taking a few moments to think about something you're grateful for. Research continues to explore how positive emotions and stress management influence heart health. While gratitude isn't a treatment for heart disease, Reducing unnecessary stress is an important part of overall well-being. And now we've reached perhaps the most overlooked habit of all. The seventh habit is forgetting or delaying your prescribed morning medications. This isn't a glamorous topic, but it may be one of the most important. Many older adults take medications to help control blood pressure, cholesterol, diabetes, or heart rhythm problems. These medicines only work as intended when they're taken according to the schedule recommended by the healthcare provider who prescribed them. Sometimes people forget. Sometimes they become busy. Others decide to skip a dose because they're feeling well. But feeling well is often a sign that the treatment is doing its job. If you have questions about your medication, experience side effects, or have trouble remembering your doses, don't stop taking them on your own. Instead, talk with your healthcare provider or pharmacist. There are many practical ways to make medications easier to remember. A weekly pill organizer, a phone reminder, a written checklist, or linking medication to another daily habit, such as brushing your teeth or eating breakfast. Small systems like these can make a big difference over time. So, what would a heart-friendly morning actually look like? It doesn't have to be complicated. Wake up and give yourself a few moments instead of rushing immediately into the day. Drink a glass of water if it's appropriate for your medical condition. Take your prescribed medications as directed. Enjoy a balanced breakfast if it fits your health needs and your healthcare provider's recommendations. If you enjoy coffee, pay attention to how your body responds and consider having it alongside food rather than on an empty stomach. Spend 5 to 10 minutes moving your body, take a gentle walk, stretch. Do a few chair exercises, practice slow breathing. Then begin your day feeling energized instead of overwhelmed. These habits won't guarantee perfect heart health. No single routine can do that. Heart health depends on many factors, including genetics, age, medical conditions, lifestyle, and regular health care. But healthy routines performed consistently over months and years can support your heart and your overall quality of life. It's also important to know when to seek medical advice. If you experience chest pain, pressure, shortness of breath, sudden dizziness, fainting, pain spreading into your jaw or arm, or any symptoms that concern you, don't assume they're simply part of aging. Seek prompt medical attention. If you think you may be having a heart attack or another medical emergency, call your local emergency medical services immediately. Never try to diagnose yourself based on information from the internet alone. Regular checkups remain one of the best ways to protect your heart. Simple measurements like blood pressure, cholesterol, blood sugar, weight, and heart rhythm can often identify problems before they cause serious complications. Many heart conditions develop quietly over many years. The earlier they're recognized, the more opportunities there are to manage them effectively. Let's quickly review today's key points. Start your morning by staying hydrated if it's appropriate for your health. Be mindful of drinking large amounts of coffee on an empty stomach. Avoid sitting still for long periods after waking. Choose a balanced breakfast instead of relying on sugary foods. Give yourself a few peaceful minutes before diving into stressful news or social media. And never forget to take prescribed medications exactly as directed by your healthcare provider. None of these habits needs to be perfect. Healthy aging isn't about perfection. It's about making small, realistic choices that add up over time. One healthier breakfast, one extra glass of water, one short morning walk, one reminder to take your medication. Those small decisions may seem ordinary today, but over the years they can help support a healthier heart, greater independence, and a better quality of life. Thank you for spending this time with us today. If you found this video helpful, we'd love to hear from you. How old are you, and which morning habit surprised you the most? And if you've developed a morning routine that has helped you feel healthier or more energetic, share it in the comments. Your experience could inspire someone else in our community. Thank you for watching, take good care of yourself, and we'll see you in the next video.